Hello there, it's Friday. It's me, Dr. Polly Heil-Mealey with Facebook Live, and we are located at Abundant Health and Wellness, Main Street and Avenue C. So just wanted to welcome you. Today we're going to be talking about breast health and breast cancer. So I have done multiple presentations on this topic this month, and we have not done one on Facebook Live, so we're going to do that. I'm also going to post in the comments a national webinar that I did for Transformation Enzyme Corporation. So we're going to have that. It's a free webinar. You have to sign in to watch it, but it is free, and it'll give you just a whole lot of information, lots of graphics, lots of paperwork, and so it's things that I can't do here necessarily on Facebook Live. So hopefully that you will get that and you will like that. So let's talk about breast. Both men and women have breast tissue. Normally on men we call it chest, on women we call it breast, but it is the tissue is mostly lymphatic tissue. Now what that means is that there is a good drainage system that goes through that tissue, which means that if you don't hurt the tissue or cut off that drainage, then you're going to be very healthy in the breast. And so we really want to talk a little bit about that. So you can go on Google Images and you can look at breast lymphatic tissue, and it will show you the different types of tissue that's in the breast. It will show you the different pathways to drain the breast. So lymphatic tissue means that there are lymph nodes, lymph vessels that traverse that tissue. It is a corridor for toxins and pathogens to be moved through the tissue and out of the body. Now, just so you know, just to review, you've got some lymph nodes in your neck. When you get a sore throat or whatever, they will get swollen. When you swallow, you notice it. You've got lymphatic vessels in the underarm, the axilla. You also have through the thorax and the spine. You've got a lot of lymph activity in the groin, right where your thighs meet your pelvic bone. That's the groin area. There's lymphatic vessels there. And then behind your knees also is a bundle of lymphatic vessels. So if you've ever had a Baker's cyst, if you've ever had that swollen patch behind your knee, the technical term is a Baker's cyst. What you're seeing there is congested lymph. Now, when you have congested lymph tissue, what that means is that the body is not able to clear it, that the lymph nodes are not pulling things through, and so you've got bacteria, viruses, pathogens of all sorts, could be a parasite, whatever, that gets locked in that tissue. If the body cannot move it, if the body cannot shift it, then the body is going to encapsulate it. It's going to make a little sac or a bag. We call that a cyst, and it holds whatever is nasty in that place until the body has an appropriate pathway in order to let that pathogen go through. Now, a cyst can turn into a fibroid. It can also turn into a tumor. So we don't want to have those things, but this is the body's mechanism for keeping pathogens out of the visceral area, out of your essential organs, your survival organs. So on the breast tissue, what do we do to clog up that lymphatic tissue? Well, a lot of things. We wear bras, okay? Now, I'm not in favor of burning your bra or not wearing your bra. I'm not in favor of that at all. What I am in favor of is that you do not wear underwire bras unless you're just doing it for a special occasion. I am all in favor of lymphatic massage for the breast. Now, before you kind of wig out on me thinking, I am not going to let anybody touch my breast, I understand that. You can do this yourself, okay? You can have your spouse do this for you. Lymphatic massage. So we're going to look at my hand here, right? You can see that I've got blood veins here. You can see that. They're blue, right? So on top of the blood veins, you've got lymphatic vessels. You don't have any color to them, but scientifically it's proven that your circulatory pathway Then on top of that, you've got your lymphatic pathway. On top of that, you've got your traditional Chinese meridian pathways. Okay, you can't see those. They have been able to be seen in a very, very high-powered electron microscope. So they are there. It's been proven that they are there. We're not talking about that right now. What we want to do is get the lymphatic tissue moved. So if you think of my finger here as a feather, you want to just touch that skin just very, very lightly, just like you would with a feather. The lymphatic vessels are very close to the top of the skin. It doesn't take a lot of pressure. It doesn't take a lot of effort. But what we want you to do is we want you to take we want you to massage the breast into the axilla, because that's where your lymph nodes are. Now remember, you've got your Pac-Man creatures, your macrophages and your phagocytes that live in the lymph nodes. What do? They are the little, as I said, Pac-Man creatures that eat up all the bacteria, all the viruses, all the yeast, all the fungus, all the germs. So you want to keep that lymph flowing, right? So just the very lightest of pressure, you're going to press up from the nipple up to the outside of the underarm. From underneath, you're going to go up to the underarm. You can, in the midsection, you can wipe down or wipe up, whatever is more comfortable for you. But what that's going to do is that's going to stimulate lymphatic drainage, and that's what you want. We've got a really good herbal formula here called LCW, which stands for Lymph Cleanser. The W stands for the herbalist who made up the recipe. I don't know what that is. I just buy the bottle and I use it. It is fabulous for moving the lymph. So if you have any kind of breast issues, you're going to want to do that for 60 to 90 days to make sure that that lymphatic pathway is open. Another thing that we do is that we put deodorant on our underarms, but some of us don't use deodorant. Some of us use something called antiperspirant. Now, I am a fan of antiperspirant because I don't like being sweaty. However, when you use an antiperspirant, it's got an ingredient called aluminum chlorohydrate, okay? So that aluminum chlorohydrate plugs up the pores in your underarm so you cannot sweat. Sweat has a lot of different jobs. Number one, it cools down the body when you're hot. But number two, it pulls out toxic material. So if you plug that up with that aluminum chlorohydrate, you are stopping the flow of lymph. And so you're going to get clogged up, stagnant lymph nodes. And so whatever toxicity is in the breast, it's going to stay in the breast, and it's going to become a tumor, a cyst, a fibroid, something like that. So we want to not wear our bras with underwire in them, and we don't want to wear antiperspirant. We want to wear deodorant, right? You can make it yourself with coconut oil, baking soda, essential oil. You can do it yourself. I've done it for a few years now, and it's good stuff. But you may want to do that. You may not want to do that. I don't care. You just don't want to have the aluminum chlorohydrate in there. So look at your product and see what it has in there, because we want to protect the breast. Your breasts are the part of your body that age the fastest. So if you'll look at my presentation that we're going to post that link to, you will see that there's a slide there that shows that there is a woman who is around 44 years old, but I think her breasts were 67, the equivalent of 67 years old. So the breasts really do age faster. Because they age faster, there is a cellular breakdown called senescence. And if you watch that video, you'll get a little bit more understanding about that. So I don't want to kind of go over that whole video because I'm going to put that up there for you. Okay. Also, to protect the breast, you can do monthly breast checks. If you are a woman of childbearing age or fertile, you want to do this at the same time of the month, because you know you have breast changes whenever you are on certain times of your cycle. So we want to make sure that that happens. We want to make sure that that works well for you. Now, there are 4 main causes of cancer. What would that be? Well, inflammation is the first one. Oxidation is the second one. Glycation is the third one. And then angiogenesis is the fourth one. So I'm sure I've given you just a whole lot of words that you don't know anything about. Inflammation. When something is inflammation, think hot, think aggravated, think irritated, okay? So when your tissue is hot, aggravated, irritated, it's going to be inflamed. If you have a fever, that is an inflammation response. If you have swelling, that is an inflammatory response. And so we want to make sure that we don't have inflammatory occurrences in our body. So there are several different things that can cause inflammation. Trauma, physical, mental, emotional, spiritual. Trauma causes inflammation. Chemicals, okay? Radiation, and then chronic stress. I think everybody has chronic stress, especially in these days. Now, I don't know about you, but I've checked our mailbox and we don't have any pipe bombs in our mailbox, so I'm really glad about that. But now we have to look for all these other things, so we all live in a state of chronic stress, okay? Oxidation. Think of oxidation as rust, all right? So think of your apple. You cut your apple in half. You leave it sitting on the counter. You go back in 20 minutes, and what's happened? The apples turn brown. Why? Because of oxidation. And so we want to make sure that we are not rusting from the inside out. So what happens to make that happen? Lack of sleep, chronic stress. All right, we have an innate immune system to handle oxidation, but if that gets messed up by poor nutrition, poor diet, poor sleep, poor mental health, anything like that is going to cause that oxidation, so we're going to be rusty from the inside out. That causes your breast tissue to be very, very sensitive to any assault from any pathogen, okay? Glycation. Now, glycation is a medical term, and what that means is that your enzymes are not working properly. I could go into a real long medical thing, but you don't want to hear that. All you want to know is you have to have your enzymes working properly. So how do we do that? Well, number one, we make sure that we get good sources of protein, because protein gives us our amino acids. The people out there that are vegetarian or vegan, you're going to have problems with this, because vegetables do not give us 100% of our amino acid need. So if you're not eating meat, then you need to have a really good amino acid support product that will give you all of your essential and your non-essential amino acids. Why? Because amino acids are changed in the body to become enzymes. Enzymes work with the body. They are those chemical keys in the body that turn genes on and turn genes off. So we want to have everything working the way it needs to. We have to have good enzyme activity. So a lot of times we'll be talking about enzymes as in digestive enzymes, but you also need proteolytic enzymes, and so I can help you figure out the difference in that. Angiogenesis. Angiogenesis means new blood supply. If you have a tumor, or you're going to be building a tumor, the body needs to supply it with blood supply. So this is a not pretty subject, and I hate to bring it up, but for every pound of weight that you are overweight, you have between 1 and 2 miles of extra blood vessels, right, to support that extra pound of weight. So the vessels not only hold the structure of the weight, but also it supplies nutrients to that. So angiogenesis is one of the main causes of cancer. Now, we know that if you are obese, you have double the chance, double the risk of having your blood work come back and say that you are diabetic. If you are diabetic, you've got 4 times the risk of becoming a cancer patient. So not, it's just, times 4, it's 400% more likely. So we don't want to do that. We want to make sure that we keep ourselves healthy at a healthy weight and that kind of thing. It has been noted in research that vitamin B12 is very, very good. It's a good breast tissue protectant. Women that have breast cancer are B12 deficient. So I'm just going to throw that out there. What makes you B12 deficient? Well, age. If you're over 50, you're more likely B12 deficient. If you take long-term diabetic medication, you are probably B12 deficient. If you have had ulcers or an H. pylori infection, if you do a lot of acid reflux medications, PPIs and that kind of thing, you probably are B12 deficient. So we don't want you to be B12 deficient. If you're B12 deficient, then your breasts are going to suffer from that. If you have any kind of intestinal dysbiosis or disturbance, you're probably going to be B12 deficient. So there is a huge link between B12 and cancer. I'm just going to read you a little blurb here. It says, without B12 and folate, the DNA can break down to the point where mutations and cancer can occur. B12 is required for methylation. Now, methylation is another big word. You can Google it, or I'll try and explain it in just a minute. If methylation genes get turned off, unhealthy genes are turned on. So, methylation, think of the cell cycle, the work cycle of a cell. You can Google that, you can look at that, but basically there are several different, I think there's like 6 or 8 different components in the cell work cycle in the mitochondria in every cell of your body. 2 of the things that it needs is B12 and folate. Okay, so if you are deficient in B12 or you are deficient in folate, you're not going to complete your methylation cycle. If you do not complete your methylation cycle correctly, then you're setting yourself up for DNA breakage. And when DNA breakage occurs, then we have those mutations and then we have those cancer cells. So a great protective there is to make sure that you have your B12. Now, there are several ways that you can get your B12. You can get it in an injection, which is very expensive. Back in the day, they used to call them gold shots. I've never had them, but they make you feel like $1 million, and they're quite expensive from what I remember. And so they're called gold shots. But we have a great supplement here that is a methyl B12. So what that means, it's got all of the cofactors, and you know I love cofactors. It's got all of the cofactors in it that keep that give you all of the nutrients that you need to get that cell methylating properly. If you are over 50, you probably have methylation issues. Why is it that older people have more sickness and disease? Because they have methylation issues. So if you keep your cell doing what your cell needs to be doing, you're going to alleviate a lot of those methylation issues, so you're going to alleviate a lot of sickness and disease. And this is what we're all about here at Abundant Health and Wellness, helping you live long and live to a good age, okay? So we want to talk about the DNA breakage, the methyl B12, and the folate, right? So let me see my notes here. Decreased, we've seen this on blood work, decreased B12 equates to high homocysteine in the blood. If you have high homocysteine in the blood, you're going to have a lot of inflammation. Now, we talked about inflammation as being the #1 cancer risk, so we don't want to do that. There's also a correlation with breast cancer and the Epstein-Barr virus. So, Epstein-Barr, we've done quite a few videos on Epstein-Barr. 95% of adults in the United States are carriers of the Epstein-Barr virus. So whether you have had any symptoms or have not had any symptoms, more than likely you do have the Epstein-Barr virus. So the Epstein-Barr virus is part of the HHV-4 family of viruses, which includes herpes, chickenpox, and shingles. So it belongs to that little lovely family of viruses. And who has not had the chickenpox, right? Who has not had a cold sore, right? Almost everybody has. 95% of the population has Epstein-Barr virus. Epstein-Barr remains dormant in the body until it is activated by trauma. And remember, we talked about trauma a while ago. It can be any kind of physical, mental, emotional, spiritual. You get a divorce, that's trauma. You move home, that's trauma. Your kids go crazy, that's trauma. You sell your house, you lose your job, all of those things are trauma. But also, here are some other factors. Radiation, pesticides. Now, who of us do not go out in the garden and spray for bugs, right? We all do it. Hopefully we do it smart. We do it when we're covered up and we use gloves and we don't breathe it and all that kind of stuff, but all of us do that. Herbicides. Now we eat, if we don't buy organic, we get herbicides and pesticides in our food. Paint fumes, mold. Many, many homes have mold in them. If you live down here where we do, or you've had a lot of rain recently, which almost every place in the United States has had a lot of rain, then you're going to have mold issues. Mold is in the air. Mold within 24 hours after something getting wet. If it's not taken care of properly, mold will grow and set up shop there. Heavy metal exposure. So how do we get heavy metal exposure? We get heavy metal exposure from being vaccinated. We get heavy metal exposure from our dental processes, and we get heavy metal from the food that we eat. So if we're not eating on the non-GMO project, we're eating foods that are full of glyphosate, and that has a heavy metal component to it. So just throwing that out there, we get these heavy metals in a lot of places. If we are smokers, right, we get cadmium there. So there's just a lot of ways that we get this heavy metal. If we're born before 1960, then our homes were not lead-free, our paint was not lead-free. There's just a lot of ways we can have this heavy metal exposure, so we want to take care of that. Physical injuries we talked about also. All of these things can set off an Epstein-Barr viral issue. So what do? Well, we want to make sure that we do our due diligence and take care of our breasts. Now, here at Abundant Health and Wellness, we are not fond of mammograms, and we're not fond of mammograms because a single mammogram is the equivalent of 1,000 chest x-rays, so we're not a fan of that. There are more and more doctors that are coming out saying that mammograms do nothing for the women. It just hurts them and it damages the tissue further. And so we've got more and more doctors saying this is very, very antiquated, that we don't want to do this. So I'm very thankful for that. They are in the minority, but they're coming out more and more, so we want to listen to that. We here at the clinic, we encourage people to have thermography. I think I may have a card here. I do. Pardon me. Here you go. Angel. I know it's backwards, but you can see that photograph. That's what a thermal imaging looks like. You'll have green, you'll have yellow, you'll have red. Red means a lot of blood supply, angiogenesis. So we want to know where that angiogenesis is, because if there's a lot of new blood work, if there's not a lot of new blood vessels going on, it's probably feeding something. And we know, medical science will tell you that you have cancer 10 years before your doctor can find it. So one of the things that we like about thermography is that it can show that angiogenesis really, really quickly, really, really early on. So we can take some herbs and some different things and go after it that way, and hopefully prevent you from having to take more stringent methods later on. So those are some things that we can do. We also can work with the breast on a herbal level, on a frequency level, to make sure that the breast tissue stays clear, that the lymphatic tissue stays clear. If you are having Epstein-Barr issues, if you have any kind of autoimmune disease, Sjogren's, lupus, chronic fatigue syndrome, anything like that, multiple sclerosis, then you probably have the Epstein-Barr at work behind the scenes. Now understand, that heavy metals and viral loads go together. I'm not exactly sure why. I just know that here in the clinic, when we find a heavy metal load, we also always find a viral load. I'm not quite sure what that clinical connection is, but we look at that and we move forward. Now, your regular blood work will not show viral issues. You have to have certain antibody tests. So if you want to go through that expense and do that, that's one way to find out what your levels are. But also here in the clinic, we can do frequency testing to see if you have those viral signatures at work in your body. So whether you have symptoms or don't have symptoms, almost all of us have the Epstein-Barr virus. So we want to make sure that we keep ourselves healthy, that we work with the breast, that we do lymphatic massage, that we don't wear antiperspirant, and we don't wear underwire bras every day. I'm okay with you doing it, on a special occasion or that kind of thing. Make sure you do the lymphatic massage afterwards, but please don't sleep in your bra. Please don't wear underwires every day, because when you do, you just stop that lymphatic flow. The lymphatic flow flows 24/7. Now, I'm just going to kind of blow your mind with this statistic, okay? If you took every river in the world and you laid that river end to end, and then you took every lymphatic vessel in your body and you laid it end to end, your lymphatic vessels would be longer than all of the rivers in the world. So our lymph system is very much undervalued. Most of us don't even think about it unless we get a cut or a scrape, and when it gets infected and we've got the pus, then we know that that's the lymphatic system. The lymphatic system is the vacuum cleaner of the body, okay? And so we need to appreciate that, and we need to work with that. What we need to do is keep it clean, keep it clear. So any of your lymphatic herbs are going to work. One of my favorite one is one that's called Blue Iris. That is a favorite one of mine. But we've got that formula, like I said, the LCW. So if you have gone to the doctor and you have breast issues, you really want to work with a lymphatic formula. There's another formula called Red Clover Blended, and it is a great lymphatic formula specifically for the breast. And we've had people come in and they've done thermography images, and the doctors are saying we're really concerned about this because there's a lot of angiogenesis and all this kind of stuff. And so we put them on a protocol for 60 days, 90 days. They go back and they have a follow-up thermography, and all of the issues have been resolved. I have heard it said that breast cancer is one of the most easy resolved cancers that a woman can have. The thing is, we just don't know, and we get into fear. So I don't want you to get into fear. I want you to be smart. I want you to have all of the information that you can have, and we give out a lot of free information. Angel is a thermographer. She comes to us, but she also travels throughout the state. I know she's got several locations here in the Houston area, but she also goes to Beaumont. She also goes to Lufkin, and I think she goes to Livingston as well. So she travels all around. She used to go to Tyler. I don't know if she goes to Tyler anymore, but certainly in our area, she's very, very good. She's very highly qualified. In fact, her qualifications are even more stringent than the law requires, so she goes above and beyond. And the doctors that read these thermal images are actual medical doctors. They're not radiologists. They actually have been trained to do this, and they know what's going on. You can have your breasts done, you can have your whole body done, whatever works for you. So we've got a lot of support for you here. I wanted just to throw that out there today, because this is the last Friday in October and we haven't talked about breast cancer and breast health. So we're going to upload that other webinar. Remember, it's free. All you have to do is sign in, and we hope that you'll do that. There's a lot more and different information that you'll find there, and there's some practical how-tos as well. So have a great weekend, rest, take care of yourself, and I will see you next week. Take care.